Welcome to the Call to Flourish podcast. My name is Thomas Cronquist. I'm your host with Father Charles Sikorsky, the president of Divine Mercy University. Father, how are you today?
Doing just great, Tom.
Well, Father, we have another very interesting topic with Dr. Kathie Erwin, who is a professor here in our counseling school. It's on creative therapies for trauma counseling. But before we get into that, we've had a podcast with Dr. Erwin before, and she introduced herself, told us a little bit about herself. For those who didn't see that podcast, Dr. Erwin, could you give us a little bit about your background, and then we'll move into the topic?
Sure. I'm a licensed mental health counselor here in Florida, a national certified counselor, a national certified gerontological counselor, and an AMCA fellow. I'm privileged to be part of the faculty at Divine Mercy University, teaching in the counseling program. I've been a counselor for well over 20 years, and I've been a counselor educator for a significant amount of time as well. I'm the author of 6 major books, including the Group Techniques for Aging Adults series.
Very, very good. Well, today we're going to talk about creative therapies for trauma counseling. And Dr. Erwin, can you tell us a little bit about what are creative therapies and how do they differ from normal trauma counseling?
Well, let's go back to the person. We talk about in the Catholic Christian meta model of the person about flourishing. And of course, trauma ceases that flourishing. It causes people to be stuck in terrible and fearful places. And along with that, their creativity becomes stuck because that's a God-given concept that we all have to one degree or another. And what I found, I actually learned this in working with older adults who had early stage dementia. The cognitive processes that I was trained in as a counselor just didn't work because the cognition was blocked. And so I had to go what I call the backdoor approach with creativity. And I started seeing results and effectiveness. And I thought, wait a minute, this issue is not unusual in terms of trauma for a different reason, but the cognitive is blocked and sequestered in order to protect the person. It's part of that process. But how do I get around that? And I started looking for creative therapy approaches. There are some others who have written on this. One of my favorites is Dr. Samuel Gladding. And other times I just kind of went along until I found some new options that worked. Because I'm all about doing what is necessary to help a person restore their own dignity, their sense of worth, their flourishing. I'm not just stuck on one theory. I am willing to be flexible, and I really enjoy creative therapies.
Can you give us some examples of creative therapy?
Absolutely. Well, God gave us so many ways to experience the world. And one of the things I like to do is a play on the rocks therapy that we use in Green Cross. We use plain rocks to tell the family system. So I was teaching this at the University in Kiev, Ukraine, and I was showing it. And one of my students said, well, what if there were pictures on the rocks? And I said, well, I guess you could do that, but I'm not artistic. And she came in the next day and gave me a handful of rocks. You can see some here. Here's a heart that has been damaged. Here's a tree that looks a bit like out in the open and barren. Here's a family or people hugging. You can decide who those people are. And this one gets used a lot, an eye. I have a whole collection of those, and she has made more for me since. And I started using those too, because these are images that people can use to touch, to hold, to connect with, for grounding, and sometimes to help them tell a story that's a hard story to tell. And all trauma stories are hard stories to tell.
Is this like play therapy with children where you let their imaginations kick in and they express themselves through maybe the toys they're playing with? Is this just kind of a way to naturally let your guard down and start expressing yourself that the counselor can watch and get cues from?
Well, it's not exactly play therapy. I look at it more as images that will reach the person on a different level, just like sand tray, one of my favorite techniques, where we're using sand and figures and scenes. Again, it's another way to bypass the cognitive defenses of trauma. The talk therapy works well in some situations and well for some clients. So do other techniques such as EMDR and EFT. I'm trained in both. But there are those folks who are very visual. And I think this really helps them to kind of tell their story almost at a distance. a safe distance, because trauma doesn't always feel safe when people are even talking about it to a counselor.
Sounds like you're looking at different parts of the brain here, right? Part of
Yes,
the brain
absolutely.
is a logical, cognitive way we process and think of things, and
Yes.
a particular, a particular thought or may trigger some of these traumatic memories and so forth. And so we're talking about using a different part of the brain, excuse me, to stimulate the creative part, to get people to maybe think about better things or more pleasant things. Is that your approach?
Pure dumb luck. It's a PDL theory.
Pure dumb luck. Okay, yeah, I have a lot of those. Yeah. So, well, what was your first approach to doing this, and how did you?
Well, I felt like I felt like the client and I both kept hitting brick walls. This happened a number of times in traditional talk therapy. I was trained in it. I know how to do it. But, humans are so different. We're just not a one size fits all crowd. And so I started looking for other things. And I had read a little bit about creative therapies and read some other things and learned some of the techniques that Green Cross uses when we're out in the field. And then I adapted my rocks with that. Sand tray is a long-standing technique. It had been initially for children, but I can assure you it works not only well with adults, but with family groups and other groups. It's a fantastic technique. That's one of the favorite things that I teach when I am guest faculty at University of Iceland. I'm there in alternate years for their Nordmag Gerontological Institute. And actually, I've done this all around the world. And Green Cross does this when we're out using rocks as projection. But with trauma, I'm just concerned with helping a person to reach that trauma, be able to express that trauma, and let us be able to work on it. Humans are so different, and I need to be the one to adapt to them. I don't need to make them adapt to my technique. And that's why I got more involved in looking at creative therapies.
Can you explain, you mentioned sand tray therapy. How does that work?
Sand tray is wonderful. You literally have a tray. It comes in different sizes and sorts, depending on my approach is sand tray. There's also one called sand plate, but that's hair splitting for the moment. The idea is that in that scene, in a way, it's kind of projective, that you can create a situation. And I'll give you an example. One of my favorite examples, I was teaching this at one of the Green Cross trainings that I do here in the Tampa area. And my daughter, Kelly, who is a budding therapist, I do believe, has been trained in that with Green Cross. And she was working with one of our participants. And the participant only put a handful of things in the tray. A lot of people put many things. And Kelly had the good sense to let it be and just ask some very profound questions. And it was a situation of a figure and a bridge and the inability to cross the bridge. The bridge represented future. This woman had been recently widowed and was just feeling very adrift and not knowing what she wanted to do. And she kind of knew, but it was that scary step. And Kelly asked a very profound question with your little figure. What if your little figure walked across the bridge? What would happen? What if you went across the bridge? And so we use that tray to sort of metaphorically experience the what ifs. What could happen? How would it be? How would she feel? And sometimes just the tactile aspect. I mean, yes, it was originally used a lot with children, but it works great with all ages. Works great with family groups too. Oh, really good with family groups. It's just about being flexible. I think I like to try to impart this to my students. We teach you a lot of therapy, a lot of theories, a lot of things to do, but don't stop learning. So much of this, honestly, I learned after grad school.
Who developed creative therapy? This sounds very interesting. Sounds new. It's not what you would imagine therapy to look like. I mean, how did this come about?
Oh, this has been around for a very, very long time. It all depends on what you look at. If you go all the way back to some of the Aristotelian dramas, the Greeks believed that there was healing power in some of their dramas in looking at situations. I don't think there's anybody in specific. There are some techniques that are specific. But I think everybody who has looked at this, looked at art as therapy, looked at colors, looked at tactile kinds of concepts like this, I think we all have the same heart desire, is what can we do to reach a person on a level where that person can find healing and wholeness. And I really believe that's where all of us have been, and we're just trying what's out there.
When the church historically, right? We've used art. There was
Yes.
ages and centuries where very few people were literate,
Mm-hmm.
and so icons, the statues, the different artwork has been used to communicate the gospel, to communicate God's love. And it seems like, we are this, we get into thinking about the human person, we're much more than just our brain. We're much more than just our emotion, our bodies, and it's this conglomerate. And so there are ways to communicate with others, I guess, is one way to put it, outside of just what we might most naturally think is the most natural way, which maybe would just be words. But those images can be so powerful, and those experiences that people have, right? When you go to a movie, you kind of go through you're an emotional. I was watching one the other night, and it's you get into it, and your emotions go up and down. And is this kind of maybe an anthropological part of what you're trying to do here with this kind of therapy?
Absolutely. By the way, I'm going to borrow your example, Father Charles, about the church and the ecclesiastical art. I hadn't thought about that for years, but so much was communicated for people who did not have the benefit of books or reading in the early years. That's a perfect example. Art is a great approach. Colors, sand. What can we do to reach a person in their place of need? And most of this, to be honest, I got interested in and started learning about when I was working with people who had early stage dementia, because I couldn't do the traditional cognitive therapy approach. I had to find a new way around, and I just kept praying about it and trying things and saying, Lord, there's got to be a way around. There's got to be a way around. And I just started experimenting and reading what I could find of others. Because our whole job is in the counseling and psychology professions, we just need to help people, not on our terms or our favorite theories or what we like to do. I care about what the person needs. Sure, I have favorite things, but it's not about me. And I tell that to students. This is one of the most important things I can impart to you. It's not about you and what you like. It's about helping people. And if creativity does it, be open.
Maybe just for those who aren't well versed in that, but just the difficulty, the devastation that and you're talking about cases of severe trauma that have caused sort of this emotional blockage, so to speak, that inhibits them. So how does natural trauma stifle our creativity? How does it stifle our all of our different abilities?
Trauma is such an insidious and horrific kind of thing that people go through as individuals, particularly when those traumas, I think, are caused by other humans. It really thwarts an individual's ability to be all that God wanted them to be or gave them the potential to be. They become self-limited, they become frightened, they become withdrawn. And I understand the reasons why. So creativity goes out the window. And if you really can't see the world as it is, and because you are so frightened and so limited because of these traumas, which is a logical response to many of these situations, of course, then being creative just doesn't seem to be there. But it is still there because God built it in our brains as humans to be creative. So we go and tap that source. And I call it the back door. You get around that cognitive defense, and we get to give the person a chance to be expressive. And sometimes, honestly, Father Charles, just the joy of watching a person who's been traumatized and feels so limited and so isolated to do something creative or interesting is just amazing. It's amazing. It's like the sun opened and God's beam came in, because for this moment, a person has relief. And we've given them an option for that. And I learn more about them and more about ways to help.
It seems like there's so much trauma in the world today. Maybe it's because we have the news we do, the access to the news in real time, and it just seems like there's so much trauma. I would go so far as to say that watching the news can be traumatic, just to see all of the different things that are going on. And I'm just wondering, there are particular types of trauma. There's the violence that's associated with things like terrorist acts or criminal acts. There's obviously sexual trauma. There's all kinds of trauma. Are there any particular therapies that work better for particular types of trauma? Is there, or is it do these work well for across the board?
Well, human beings are complicated. There's no one size fits all. And that's why I tell students, don't be enamored about one technique only. That's my approach anyway. Some disagree, but with trauma, there's a lot of variables, and there are some techniques that that we see that are very inclusive. And our own Dr. Benjamin Keys, who's developed the heart model, which is unique in that it uses the basic constructs that have been shown over years to be valuable in working with traumatized individuals, and adds the opportunity for a spiritual element. Because I have never yet met anybody, including atheist clients, who haven't asked, where was God? They may not believe in him, but when they have something traumatic in their life, they want to know where he was. And so that's what's so brilliant, I think, about Dr. Keyes' heart model, is that we bring this in and create not only an individual's ability to come to terms with trauma and to forgive the self, even though they didn't do anything wrong. Every trauma victim somehow, almost that I've seen, feels that they are to blame somehow, but also to deal with the where was God question. And that can be a very hard one, as you certainly know from your ministry, Father.
Well, that's right. That's right. It's human beings in a way where we have a common nature, but each one of us is a mystery in a certain sense. And so much goes into that kind of a question that people would have. And I think unlocking them on, a spiritual level, an intellectual level, and also this creativity. Are there some, so are there particular kinds of trauma that this would be better for? Because there could, or is it sort of, you could, that you've noticed, right? Some I noticed it's sexual trauma, or, you could have, like you said, struggling with dementia, different things. What are there particular ones where creative therapy could help more?
In my experience, it's still very individualized. I know some people in our field will say that there is a particular group. My experience is I'm just looking at the person and their openness and their willingness to try something different, especially if we get stuck. So I like to keep an open mind in the therapeutic context. I have an idea, I have a plan, I have a treatment plan. But if I'm hitting a brick wall, I'm going to back up and find another option, because, again, I keep telling the students, it's not about you and what you like to do. It's about your client. And if I have to go in another approach and get some consultation and work with people like Dr. Keyes, who has that tremendous background, I'm going to do that. It's all about finding what reaches my client. And that is going to differ for people.
Seems like trauma is, can we say, is it fair to say that trauma is a spectrum? It can be less intense and it can be more intense. There are all kinds of traumas, and we all experience challenges and difficulties in our lives. What are some of the ways that we can prepare for? I know this is a big question, but what are some of the practical ways, or ways you see from your experience, that we can prepare ourselves for traumas, life's challenges, life's difficulties, so it's not what they say, a stitch in time saves nine. How do we prepare ourselves for the slings and arrows of outrageous fortune?
Well, that is very difficult to say. However, most research that I have read does suggest that people who had a good, solid sense of self, good sense of belonging, a good self-awareness, pre-trauma, bring in more resiliency. Now, I would add to that, because most of this is secular literature, but I would add to that those who have a strong sense of faith. Bringing in a positive life characteristics, and having done well in other, perhaps lesser situations, but challenges, give them more resiliency. Still, everybody's different. That's what makes trauma such a complex kind of work in counseling, because we have to look toward the individual. And resiliency can be built from trauma. Once the trauma, we have had some good counseling and some resolution, that actually can be a factor of resiliency.
So all this sounds great. And I have a question here, though. All right, creativity and so forth, but how can rocks and sand be therapeutic? What? Could you walk me through how that actually happens?
Oh, the sand tray in particular is really lovely. I did one with a therapist colleague of mine, actually, who knows a lot. But, we know, but sometimes we're still humans. And there was an issue involving an elder mother and family disagreeing, and she being the primary caregiver and feeling like everybody was on her case about it. We talked about if that doesn't work. I said, let's put it in the tray. So we put it in the tray, we put the situation, we put the people. And as we commonly do, say, okay, here's the situation as it is. If nothing changes, this is the way it is. What would need to change? And she used those figures to move them around. I said, okay, how would that happen? How would you get there? What would happen? And so we did some what if scenarios, if you will. Now we do that sometimes verbally in counseling, but I think for many people, there's great value in seeing something. What if this moved? What if this changed? And I did a demonstration. I was doing this at American Association of Christian Counselors in a workshop this year, as I did 2 years ago. And right before the session, one of the therapists walked up to me and said, are you going to do the demo again? And I said, well, I can't do it quite the same way because of COVID protocols. So I'm going to, she goes, oh, I hate that. I go, why? And she goes, I was one of the people you did this with last year. And she said, I've been a therapist for 20 years. And there was a family issue I've been carrying. And I was up on stage with you for 10 minutes. And I had one of the first breakthroughs I've had in a long time. And I just want to let you know it's still lasting. I was amazed. I mean, that's God, really. That's not me. I'm not that good. But that's God giving me an insight. And I was thrilled to hear that. Now, it doesn't work that way every time. I wish it did. But it is just another way to help people.
Another way to help people. Yeah. Wow. That's a powerful story. So where could we have a lot of counselors and therapists who watch or listen to the podcast. Where could they get more information to learn about this and creative therapies? And anything you could recommend for them?
Well, I know that we at Florida Mental Health Counselors Association, I do that training regularly. And one of my favorite sand tray sites where I have done training is called Southern Sand Tray Institute. You can look it up online. I love their work. I'm very impressed. They also do some focus on trauma. There are some good books out about that. And I would love to do a training. I was going to speak about that actually, do something that maybe even for our students so they can see some of these options. And maybe we could even record it.
Our students here at DMU, are they exposed to this kind of a treatment?
No, but they're going to be because I'm here.
Going to be. Oh, okay.
I'm not aware that they are. I don't think our counseling students are. I don't know about our PsyD students, but there's so many basics. To be fair, in all counseling and psychology programs, there are so many basics that by accreditation and necessity we have to teach, just like medical schools. And then once you get out, you start to specialize. And that's really where you start to gain a lot of this. Other than those, our wonderful faculty, which represent so many different specialties, our students are getting some of these exposures early on.
Dr. Erwin, you mentioned how trauma impedes cognitive capacities, and oftentimes it's asked, where was God in this situation, in the particular trauma, the trauma event? Does this creative therapy help move people toward understanding maybe a more, I don't know, how do I say, a theological perspective or a greater perspective on the cosmic struggle between good and evil? There's a professor here, very good professor, I'm sure you know, Dr. Bill Nordling, who's mentioned to me that the task of a good psychologist, good counselor, is to move people to the doorstep of faith, remove the obstacles, sort of like John the Baptist, who prepared the way for the Lord. How does creative therapy maybe remove those obstacles toward faith, toward maybe seeing a grander perspective, if you will? How does that work?
Oh, there have been plenty of times in Sand Tray that we have talked about God. And we have a lot of different figures that we use. And so I have several. I may have a cross, or I may have, a beautiful light, whatever people choose to represent God. And I will ask that question, regardless of their religious orientation, spoken or unspoken. Do we need to talk about this as part of the situation you're feeling? Yes, we do talk about that. So it is just another way. We do this in many ways in counseling because, as I said, even people who claim not to believe in God want to know where God was when the hurricane hit, where God was when the accident happened. which I listen to very gently and go, well, that's really interesting. I thought he wasn't around, but you want to know where he was. So maybe he really is around. What do you think? And we do have to and with people of faith who know the Lord and love the Lord, that sometimes is actually harder because they're where it's like, wait a minute, I've loved him, I've served him, I've taken my children to church, I've raised them in the faith. Why me, Lord? I think most every human at some point in their life will ask, why me, Lord, or why not me, Lord? And it's a pretty common question. I bet you hear that one, Father Charles.
Well, yeah, my ways are not your ways. And it's just a mystery of God's love that sometimes it doesn't seem like love, but there's always a reason for it. And really, I think it's a challenge for us to grow in a deeper spirit of faith, a deeper supernatural spirit about things, trusting that we truly are in the loving hands of our Father. And you're right. I think everyone has to deal with that. And maybe one way to think about it, especially for those who are more, as you said, more devout, more spiritual, more people of faith, is maybe God's trusting you with this problem because he thinks you can handle it and he's going to be there with you. And that may sound harsh, but as we know, our Lord and Savior went through the pain of the cross and all that suffering. So suffering is not separate from Christian life. And sometimes suffering is not understanding why, not knowing why, or feeling misunderstood.
I've been asked those kind of questions many times, and I really prayed a long time about it. And years ago, I finally came to the resolution. The only answer I had was I always say, go back to your spiritual source and your spiritual leader. But the best I can give to people and the best I can understand is it's a free will problem. The free will of one person to do you harm overcame your free will to not be harmed. And that's the best I've got. And when a person harms another, I don't understand it. It doesn't make sense to me. But that's all I've been able to say is that, but now you do have your free will. You have your free will to not give that person free rent inside your head. And that's what we're going to do. We're going to kick them out of that place that continues to harm you every day so that we can truly do what God's word says, set the captive free. And I will say, and I think other trauma therapists can relate, it may take a long time, but when you see that happen in your office, I know it's the power of God. It's not me. It's never me. But just to be that close to it is overwhelming.
Dr. Erwin, it sounds like what we're talking about, there's a great precedent in the book of Job, in the Old Testament. Job suffering tremendous trials and asking, why me? And in the end, his questions answered to some extent. His struggles, his trials, holding on to faith. Would that be helpful to people that are going through trauma, or they're not there yet? The book of Job might be too much traumatic in itself. What are your thoughts on that?
Well, at times I think there are spiritual stories from our heritage that can be helpful to individuals. Other individuals may not relate as much to that. Frankly, as a counselor, it's a trial and error. When I can relate something that a client will find acceptable to a spiritual or historical background from our faith, definitely I think that strengthens the example. But I have to have a sensitivity to see whether or not this is something that is relating well to the client.
Well, Dr. Erwin, this has been a very interesting topic again, and I'm very glad that you're bringing this knowledge and this the experience you have in this type of therapy to Divine Mercy University and teaching our students about this, because it seems like it can be very, very effective. I'm wondering if somebody has a particular question for you, can they contact you directly? And if so, what would be the best way to do that?
I'd be delighted to speak with anyone about these subjects. You can email me at kerwin@divinemercy.edu. That's my email, and I'd love to speak more with you, especially those who are in the counseling field. It's just so great to learn from each other.
Again, Dr. Erwin, thank you so much for being with us today. Again, this has been a very interesting topic, and look forward to speaking with you about other topics in the future. So have a wonderful day.
Thank you.